There it was, a C-130 Hercules taking off from St. John's just a few minutes ago, carrying a civilian medical team to help Ontario fight its ongoing pandemic third wave crisis. 9 nurses, doctors, and a critical care nurse practitioner, all in the air now, sent off by Newfoundland and Labrador. It's the first response from other provinces to Ontario's plea for outside help. Ontario Premier Doug Ford calls them healthcare heroes. His province's healthcare system is stretched right now to the limit by the surge led by virus variants. There are currently about 2,300 people with COVID in the province's hospitals, 877 in intensive care, and that is a record. Today could be the day that Ontario passes the 900 threshold. So as we look at those images just from, as I say, a few minutes ago, here's a photo that was just tweeted out a few minutes ago as well by the Premier of Newfoundland and Labrador, Andrew Furey, hugging his wife, who is a member of the team, Dr. Alison Furey, both of them medical doctors. She's now on that plane and flying to Ontario. He has said at a briefing this morning and said on Twitter that he's proud of her commitment along with the rest of the medical team. And he was there in that hangar to see off the team as it leaves for Ontario. Peter Cowan has been guiding our coverage throughout the morning, right there in that hangar as well. You saw the Premier, you saw the team, you saw the takeoff, Peter. Wrap up what's been going on there today.
It's been a busy day here at the St. John's Airport, and the team is now in the air. They're going to make a stop in Deer Lake to pick up one nurse from the west coast of Newfoundland, and then it's straight to Pearson International Airport in Toronto to drop off those workers. And on board the flight, a couple of doctors, several nurses, and these were all people who volunteered. They put up their hand when the call went out for people who could be able to take time out of their lives and come to Ontario. And one of the nurses said, you know, when she heard the situation that her colleagues in Ontario are in, there's a bond between healthcare workers, so she really felt it was her obligation to do what she could to help.
We have a small but mighty team heading up to Ontario, and the experience alone on our team is second to none, and we really look forward to getting there and lending a helping hand.
These 9 people are going to be a help, but it is still a far cry, Heather, from the 620 healthcare workers that Ontario has said it needed in order to take some of the relief off the system right now, with so many healthcare workers who are just being burned out from having to deal with those thousands of patients that are in the hospital right now because of COVID-19.
Well, exactly, and that's why the Premier is calling this team healthcare heroes. And I was speaking earlier this morning, Peter, to a doctor in the University Health Network in Toronto, and she sort of lit up at word that the team is on the way, because she said they're certainly going to be welcome as they help with the crisis situation in Ontario. Why is Newfoundland and Labrador able to help in this way, and why has the province decided to step up, Peter?
It is interesting because lots of other provinces have said, look, we don't have the capacity to be able to spare anyone. And that was a concern that we heard here as well from folks like the Nurses Union, who'd said, look, there are some areas that are already stretched. You know, there are already wait times or surgeries that get canceled. But what the Premier was able to do is he said, look, we were able to find some people where there was a little extra capacity in the system, and we're able to send them. And this is something that is near and dear to the Premier's heart. He is an orthopedic surgeon by training, and up until last August, that's what he did. He has a lot of experience going to helping in developing countries, places like Haiti after the last earthquake, where he went down with a team in order to help people there. So, you know, this is something that he feels pretty passionately about. So when the opportunity came up, he got on the phone with Ontario Premier and said, look, let's see what we can do in order to help.
There is a passion there that you can't get rid of just because you take on a new role. So there is a big part of me that wishes I was going, but I'm incredibly proud that a member of my family is going. And as I look around the room and see the people who have stepped up and their families, and hear the stories about how they put their hands up right away, it's incredibly heartwarming. And that's the spirit of Newfoundland and Labrador, and that's why we're here to help.
This afternoon, they're going to get right to work. They've each been assigned someone that they're going to kind of shadow for the afternoon. They're going to learn a little bit about what's involved with that job, and then they're going to be the ones who are able to spell off a few of those healthcare workers, give them a little break as they take over. Heather?
Peter, thank you.